Hi everybody, I'm Claudia Ravaldi from Italy and I run CiaoLapo Foundation for Perinatal Health. Today, I'm going to show you the results of the studies we are conducting in Italy since March 2020 on respectful perinatal care and COVID-19. This presentation is part of a larger study called COVID Assess that is a cross-sectional survey on 1,307 pregnant women interviewed during lockdown and post-lockdown period in Italy. In each slide, you can find a QR code that links to methods and results that are either published or currently in preprint. We all know that since January 30, 2020, the World Health Organization declared the pandemic status due to COVID-19. Italy was one of the first countries severely hit by pandemic, and in early March, the government adopted national lockdown measures, trying to contain the spread of the virus. Those were very hard times, since we know almost nothing on SARS-CoV-2, about its transmission, how it affected the health of general population, of elderly people, and if it could impair well-being of pregnant women and newborns. In those days, as researchers in the field of perinatal health, we asked ourselves several questions. If pandemic per se could be considered a traumatic event, what its impact on pregnancy and postpartum, and how could we manage pandemic in order to reduce the risk of post-traumatic stress disorder. Unfortunately, at that point, no studies on COVID-19 and mental health were yet available, and in particular, no specific study was present on mental health and well-being of women during pregnancy or postpartum. We refer to the World Health Organization definition of health. And as you can see, we notice right from the beginning that physical well-being and mental well-being were severely affected by COVID-19, and also social well-being was impaired, especially due to the severe restrictive measures that the Italian government adopted in order to save lives. That's why, in our opinion, COVID-19 pandemic possesses the full characteristics of a traumatic event. We know that there are many types of trauma. A single event, represented by only one acute traumatic condition, multiple events with many repeated events in a short period of time, complex traumas in which people are severely affected by multiple events and develop severe reaction and difficult adaptation to them, and finally, we have system-induced trauma. So, we ask ourselves if restrictive measures for pandemic represented a sort of system-induced trauma for women. Furthermore, we know that we have three possible responses to a traumatic stress: fight response, flight response, or freezing. But we did not know what actually was happening in the minds of pregnant women during the first weeks of lockdown in Italy. In fact, the answers to a traumatic stress is a very complex mechanism that combines the interplay of amygdala, hippocampus, and prefrontal cortex, but also relates to the health of our precise nervous systems, our precise personal story, how we are at the moment of the trauma. And all this also influenced by our action, how we respond, how we manage the trauma in which we are living. We know from medical and psychological literature that being pregnant in a stressful moment could negatively influence the well-being and the health of mothers and babies. Stress can induce epigenetic changes, can affect neural development of baby's brain, and eventually promote the development of postnatal depression and other postpartum disorders. We also know that each event can affect the others, and altogether they may have a severe impact on health and well-being of mothers and babies during pregnancy and postpartum. But we also have the possibility to cope with trauma, to give a proper support to women, thanks to the process that we call resilience. According to Julie Engel, resilience is the innate capacity and the ability of humans to stay present, grounded, and effective in the midst of difficult and challenging circumstances. But in order to improve resilience, we have to assure that human priority needs are satisfied. And according to Maslow's hierarchy of needs, in fact, one of the biggest priority of people is the need of safety, the need of perceiving themselves secure and safe. Being able to rest, being able to develop intimate relationship and friendship may really help in order to develop resilience. In March, WHO soon highlighted the need of maintaining respectful care during pregnancy, labor, and childbirth for all women despite COVID-19 pandemic. This was a very powerful position statement because in many places around the world, the must-eat people at first were indeed pregnant women. In fact, also in Italy, it happened the same and many human rights advocates claim for respectful care. For example, among the activities around the world, White Ribbon Alliance produced very good documents to point out women's needs of being respected and to increase resilience both in women and babies. In Italy, we also tried very soon to promote respectful care together with several associations. CiaoLapo, my association, with La Goccia Magica and Of Italia, for example, developed an Italian position statement trying to get in touch with institutions, hospitals, maternity wards, and to remind them what are the most important points of respectful care for pregnancy and postpartum period. Unfortunately, some mothers told us that hospitals' procedures were severely hit by restrictive measures. For example, I'm quite okay. I wish I could finally make the visit that was postponed to see if my twins are okay. Another one. The absence of my husband on the last visit saddened me because he wasn't allowed to attend, and worried me, on the other side, because I missed his presence. And another woman say us, it's like I'm stuck, spectator of something I don't understand. I struggle to believe it's my life. That's why we set up COVID Assess study, and we interview more than 1,000 women coming from all Italian provinces. More than half were under 35 and almost all were well educated. The majority of them was in the third trimester, so very close to labor and childbirth. And during the first phase of the study, most were at the beginning of the restrictive measures in the first few weeks of lockdown. In the second phase, a consistent part had been in lockdown up to 10 weeks. Our aim was to assess the perception of women, but also to reassure them, to not to be scared of COVID-19, to remind them they could ask for a companion of choice during visits and childbirth, and that they could call their midwives or obstetricians to ask for advice. It was a very important point for our women. Unfortunately, despite the general efforts, we have shown in this paper published on Women and Birth, by the way, it was the very first paper published on pregnant women concerns for COVID-19, that the perception of childbirth and postpartum changed dramatically in Italian women, especially during the very first weeks of lockdown, in March and April. Here we can see, in blue, the emotions and feelings towards birth before COVID-19, and in red, the perception after the lockdown started. We can easily see that joy, anticipation, surprise, and trust left place to fear and sadness. In March and in April, we had a very sad, disturbing picture of Italian women at the beginning of the pandemic. Moreover, when we looked at the psychological constructs, we assisted to a dramatic change in opinion and perception of the whole process of labor and childbirth. Constructs such as closeness, safety, security, serenity, love, and hope left the place to self-doubt, restriction, worry, danger, anxiety, and loneliness. It was a very dramatic change. Women were scared and disempowered, and their expectation of the moment of childbirth that before COVID-19 were positive and joyful changed completely. Their very first thought was about restriction, loneliness, anxiety, and danger. not anymore love and closeness. As I said, fear was the pivotal emotion during lockdown. We know that fear can be a normal emotion at birth, but as we can see on the left, it is usually combined with joy, happiness, sharing, and serenity. After COVID-19, fear was instead combined with abandonment, loneliness, sadness, and restriction. A very different picture. Furthermore, in a paper just published in Archives of Women Mental Health, we found that post-traumatic stress disorder symptoms in pregnant women during lockdown were also a very important issue. Here you can see that pregnant women with a previous history of anxiety or depression on the left panel, or with an anxiety personality trait on the right, show high levels of post-traumatic stress symptoms. We think this finding is important, since if we simply ask women, have you ever suffered from anxiety or depression during your life? And they say, yes, I have suffered from one or both illnesses. Well, these women are significantly more likely to suffer from severe PTSD symptoms, and they obviously need a specific management during pregnancy in order to reduce their anxiety and to improve their mood. Now, when we compare the first lockdown period, March and April on the left, with the second phase of the first wave in Italy, May, after lockdown was released on the right, we notice that something changed in a very significant way. These are unpublished data just now, and we can see that COVID-19 concern decreased in almost all Italian regions, from dark red to orange. Here we can also see that from phase 1, dark blue, to phase 2, light blue, all health-related worries significantly decreased. For elderly health, for example, that was the most important before, for partners' health, for babies' health, and also for women's own health. Please note that the worry for their own health was the lowest concern of pregnant women, both during and after lockdown. Instead, all worries regarding society's future and jobs' future did not decrease, unfortunately, after lockdown. If we look at the effects of restriction on maternity antenatal care and childbirth care, we see that despite a significant improvement from March to May, women were very unsatisfied regarding several aspects of perinatal care. In particular, a relevant improvement was present in many hospitals regarding prenatal visit schedule. Thanks to technology, women were able to stay in touch with professionals who were also considered emotionally closer. So, a good news. Anyway, we still assist to several critical issues that were the same, highlighted by WHO and world activist groups. These issues should have been managed better and solved from the very first part of lockdown, in particular regarding the information on hospitalization, birth plan respect, and the presence of partner during labor, childbirth, and postpartum period. Unfortunately, these issues remain critical after lockdown, also when it was released in many Italian maternity units, and as far as we know, they still remain critical right now during the second wave of COVID-19 that is severely affecting Italy, just while we are talking now. Almost the same happened in several countries, for example in England, where a lot of people are adhering to the movement but not maternity, in order to reintroduce respectful care in pregnancy and childbirth, underlying that lots of restrictive measures were released in several domains of everyday life, supermarkets, ceremonies, but not in maternity care. The worldwide investigation Cocoon, coordinated by the Mother Research Institute in Brisbane, Australia, is currently ongoing to assess continuing care in COVID-19 outbreak during the different waves of pandemic in 14 countries, including USA, Canada, India, Brazil, Italy, and all European countries. In conclusion, we can say that COVID-19 pandemic can definitely be considered as a severe traumatic event. It has a deep impact on women during pregnancy and postpartum, especially when they have a story of anxiety and mood disorders. Post-traumatic response during pregnancy alters the expectations toward labor, childbirth, and puerperium. Therefore, it is very important that, in order to reduce PTSD risk, maternities need to assure respectful care for all women and couples. and we have shown that this was not fully done in Italy. I would like to thank you and to leave you with this powerful message from WHO and White Ribbon Alliance. Despite COVID-19 positivity or the presence of a clinical or subclinical infection, women always have a right to respectful maternity care. Thank you very much for your kind attention.